how to remove the cemented prostheses the best possible way. Now, these methods are divided into high risk, medium risk, and low risk category. The high risk category involves the use of the pneumatic crown removers and the spring loaded crown removing instruments. They are the quickest way to remove the crowns and bridges, but unfortunately there's a lot of risk which is involved in terms of the tooth fracture when you use such instruments. So such instrument should be practiced only to remove the crowns and bridges which are on the maxillary and mandibular molars. That means only for the crowns which are on the teeth that are shorter and wider. You should never try to use such instruments for removing anterior crowns, anterior bridges, the bridges involving anterior crowns and premolars. If there is secondary caries associated with the tooth, or there is a grade 1 or grade 2 or grade 3 mobility associated with the bridge, or it's an implant supported prosthesis, or there's a portion core underneath that crown or bridge. Now the second category of instruments involves the use of crown removing pliers and forceps. Now with such instruments, the chance of trauma is very less, but also these are less effective ones. So you can engage the instrument tip onto the crown margins, and by the twisting motion you can facilitate the removal of the crown. This can be done for the anteriors and premolars, but at times you might have to section the crown before you use such instruments. The third category is the safest one, where you section the crown buccolingually and remove the crown in two different pieces, medially and distally. If you want to section the zirconia crown, then you can simply go ahead by using the black grit or a blue grit or even a green grit diamond cutting burrs. And to cut the metal, you can use the specific tungsten carbide burrs, when you can simply section the tooth buccolingually and remove it into two segments. Hope this helps.